toke farmers. Mountain back to Atlantic Ocean. Over me hills to country. To educate, elevate, and promote. Yeah. Focus on Liberia. For Liberia. For Liberia, yeah. From Monday to Sunday. From Monday to Sunday. It's focused on Liberia. Talking about home affairs. Hey. In diaspora. Foreign affairs. Reliable information. History. Talking about culture. Politics. Education. Entertainment. Business. Sports. Advertisement, articulation. Focus on Liberia. Focus on Liberia. Focus on Liberia. From Monday to Sunday. Focus on.
Ladies and gentlemen, welcome to another session of Focus on Liberia. Hey, where's Dennis?
Gabriel, I'm not on the show today.
Ladies and gentlemen, welcome to another session of Focus on Liberia on the Marketplace. I am your co-host, Gabriel Carter. Today, we would like to take some time to talk about a pressing topic, discussion within our body of politics, and that is the recently signed memorandum of understanding with the government of Liberia and the United States on the building of a health system that is supposed to be similar to what the CDC is. That is supposed to be like a data warehouse for citizens that will allow citizens to share data, but that also allows the United States to have access to that. Right now, what I want us to do is basically just talk about the MOU within its entirety, what it means on both sides, what Liberia stands to benefit from it, as well as what the government of the United States stands to benefit from it. We're going to look at the data, the system, the clauses within the MOU, and also the cost associated with it. So there's a lot to talk about. It's a handful. I think it's 29 pages, but hopefully we can do our best to peel back the layers of the onion and make sense of it. So again, joining me here today is Russell Anthony, right? Hopefully I'm saying your name correctly. And also we had Thomas. I believe he's having connection problem. So Anthony, welcome to the show. Hopefully you had time to peruse the MOU. From what you've been able to read, would you be able to give me an overview of your understanding of the MOU?
Yeah, thanks for having me on the show today, Mr. Gabriel Carter. So this MOU, it kind of gives Liberia a responsibility as well when it comes to how we look at foreign investment slash aid with the U.S. government. So it's kind of like putting like the U.S. government first initiates it. It takes the U.S. government takes a lot of the load of the project
Yep.
of data system. They will be allocating about 125 million towards this, and whereas the government of Liberia will be allocating about 50 million to it,
Yep.
to this project. So in total, we're looking at 175 over just a 6-year period, and then after that, Liberia will be responsible for any other financial things pertaining to the payments of the nurses, the collection of data, the maintenance of the systems and
Systems.
things like
Yep.
that.
Yep.
So this is something that, when I look at Liberia in the future, I look at us signing more deals like this because it doesn't just people aids and loans just doesn't just allocate all the totality of the project, but we as well too have to hold some financial responsibilities as well too. But what I don't see in this project is a lot of the operational responsibility when it comes to the protection of our data. There is not a clear cut sentence or sentences that I can see in this budget that says that
Uh-huh.
Liberia is protecting its data, its people data.
Yeah.
And when we talk about the data protection, all that um, this MOU just says is that we will be abiding by international data policy laws and
Exactly.
policies. Yeah, so we need to be able to put in our own words what those means. We cannot just abide by international policies, whereas the U.S. is actually putting in there that they're abiding by U.S. laws as well too. Um,
Hmm.
where are the Liberia data policies laws that prevents the U.S. from kind of like taking over control of this MOU? And whereas I see this MOU as well too, um, the U.S. also says that if Liberia doesn't adhere to any data access, they're able to roll back on the MOU, and
Yep.
not take responsibility for anything, and just end it, or put Liberia on some kind of like a sanction. Who knows? But Liberia also needs to say that, hey, if you're not able to adhere by our data policies, our national data policies, as
Let's
well
have our day.
as international data policies, we will cut this off. And
Yeah.
I'm pretty sure that the article that a team member of this panel just sent in a group chat just says that Kenya actually suspended, their data sharing arrangement with the U.S. as well too. But I'll
Yep.
give the host, the other panelists, time to come in and talk about.
Yeah. Thank you. That is a great perspective. I didn't look at you know the part of the contribution that we're contributing. I believe you said 50 million. So I didn't look at that aspect as well. I agree with you. I didn't see maybe I was too focused on other stuff. I didn't look at uh, the responsibility on our end in terms of really enforcing ourselves to say we are going to protect the data of the citizen. So thank you for pointing that out. Thomas, I know you briefly left us, but again, welcome. You're a regular here. Basically, what I would like to do is basically get an overview of your perspective of the the MOU in terms of how do you understand it? What do you think it is? And then we can
Thank
dive
you.
into the meats and bounds later on. Right.
Thank you, Gabriel. Can you hear me?
Yes.
Okay. So I think before we go to the MOU, it's good for us to give a context and background of the MOU. That way we are able to situate the MOU in the discussion. How did we get here? And why are we at this place at this point in time? So we all do know that before now, the US government has been the largest bilateral aid provider globally. And that aid they provide goes to different sectors, to health, to education, to food security, to humanitarian support, and all of that.
Hmm.
Since January 2024, when President Trump started his second term in office, there has been this push to be able to get away from aid and transition to trade. And part of that effort led to the dissolution of USAID. So historically, USAID has been the arm of the government, of the US government, that programs US development aid across the globe.
Right.
But as of mid 2025, and I think August 9, all of the USAID operations across the different countries actually shut down and they laid down their staff. But the message the US government had always sent is that the closure of USAID was not the end of US development aid. They said they were going to change the modality. So right now, the programming of US development aid is under the State Department. So this is why the State Department is the person who is signing this MOU with the government of Liberia. So if you go through the MOU, you will see that the ambassador is the one signing. Previously, it would be the USAID mission director signing this kind of MOU on development aid. But also, as you mentioned, that when USAID closed in Liberia, there were around 20 to 20 some more projects that were being implemented. Not all of them actually closed down because many analysts and many advocates around the world said that with the abrupt nature of the close down of USAID, people were going to die. People who were benefiting from humanitarian support from the US, people who were benefiting from health-related support like HIV and AIDS, malaria, and all of that, they were going to die. So even though the USAID projects closed down in Liberia, some of them in the health sector actually remain. Either 3 or 4 of them related to malaria, HIV, the supply of drugs, and all of that. So this MOU is actually building on those projects that are there in the health sector. So now this MOU is actually operationalizing this position of moving away from providing development aid through intermediaries. And when we all look at the signing of the agreement between Kenya and the US government, the Secretary of State made this point that the US government is no longer going to provide aid through NGOs that go and run parallel systems, parallel health systems in beneficiary countries. So this is why this MOU is signed between the State Department and the government of Liberia. So in this case now, the government of Liberia becomes the implementing agency. So we no longer have these US government firms that go to Liberia, set up their own offices, and implement projects. So whatever the implementing partners were doing, collecting data, reporting data through USAID to Congress, it will be the government of Liberia through the Ministry of Health that will collect that data and report it. So like you said, we can go through the
So
MOU
I know
because
you
it
gave us the backdrop of the dissolution of USAID, right? You pretty much said this is the reason why this was a direct negotiation as opposed to this being funneled through the USAID had it been in existence, right? And thank you for that backdrop. What I wanted to understand is basically when you read through the MOU, what were your initial understanding of it, of what it intends to do? You know, either you can look at this from different angle. You can look at this from the US angle, Liberia angle, or you can look at it from a middle ground.
So if you go, like I was saying, if you go through the MOU, it has different sections and it has different health-related interventions that the MOU is going to focus on.
Mm-hmm.
So for instance, you have pandemic or epidemics in their response. There's a section there that says that this MOU is going to be an instrument in such that it will support Liberia to be able to do research, to be able to do diagnosis, to identify if there is any outbreak of any virus or any disease in Liberia. Liberia should be able to identify in 7 days.
in
And
7
if
days.
it identifies it in 7 days, it should be able to notify the US government in 1 day.
In 1 day, right?
Also, the background to this is that this is a country that suffered from Ebola. Outside COVID-19, which was a global pandemic, the epidemic that actually shut the world over the past 10 years is Ebola. We started in Guinea, came to Liberia, and went to Sierra Leone.
Hmm.
And even when Ebola was defeated in Liberia, the US government continued to fund research through Prevail. I think the project is still there, still trying to identify what was the root cause of Ebola. So when you go to the MOU, it has something to do about identifying, diagnosing, and also being able to identify to notify the US government within a specific time frame. The other context to add here, Gabriel, which is very important, is that the US has now pulled out of WHO. So the US is no longer a member of WHO. Much of the health related data used to go to WHO because we are all part of WHO. So if the US pulls itself out of the WHO, it's no longer going to get these kind of information from different countries. So this is why it is going from one country to the other, from one region to the other, establishing this kind of partnership so that if something happens in your country, you notify them, they know how to prepare themselves against that disease that is going to come. So we have this issue of pandemic response. We have issue around laboratories. The government of Liberia wants to build laboratories to be able to test, to identify what the problems are. We have issues around strengthening data collection. We have systems in place for our drug supply. We have systems in place for laboratory systems that we have. So the MOU talks about different areas of partnership. We also have different diseases that will be covered under this MOU. You have malaria, you have HIV and AIDS, you also have maternal mortality, you have child mortality, all related to these different diseases. So in terms of the structure of the MOU, I think there is not much problem because the different sections talk about what specifically will be happening under the coverage of this MOU.
Anthony, um, do you have any point before I ask the next question?
Yeah, I mean, I'm glad that you mentioned the WHO and how majority of the data that were being collected in Liberia and other parts of, the world were actually being, you know, given to or collected to WHO. WHO actually has its own, personal data policy that just passed in 2024. And what we're not seeing here is that, you know, that particular portion that we keep pushing, which is the personal data protection policy. We
Right.
are not seeing that stressed out within this MOU, depending on Liberia's part. That's my issue.
Yeah, and I think that is the biggest problem. There's two, I believe, the 2 points of contention within the general, uh, uh, population. Those who have pontificated on this matter is basically what you just said. The point of data control over the data, and most importantly, the price tag associated with it as well, in terms of who gains control over the data, who has control over the data. Yes, we do have, if you read through the MOU, it's basically kind of like a supplement to what is already in existence, right? Even the budget itself, there's already funding in place. They're just adding to it as well. But what this MOU will also do, it will build new systems, right, that make those data shareable, right? Either within agency or also with the US government as well. The bigger question here, I think, as you raise the concern, is basically access to those data. What are they going to be using that data for? And I think Thomas alluded to that. If you identify a disease, there's an outbreak, you have 7 days, right? And you have a day to report it to the United States, right? Now, it clearly states within the MOU that the government will maintain, government, the US government will have access at all time to the data, right? That is the biggest point of contention with every Liberian who have raised this question. And I think you yourself too, Anthony, keep raising this point is in terms of it seems as if this MOU was written from one direction, meaning the US government just wrote it and presented it to the Liberian government. Instead of them reading that and say, okay, we're a sovereign nation, we're going to have clauses, we put in clauses there to protect our citizen as well, which is your full responsibility as anybody working in the government, first and foremost, the safety and protection of your citizens, right? That was never done. Right. So if you read this thing, you see it's just a handover. People are interpreting this thing as a handover of access to data, key information. Right. So that is the point of contention here. And I think I want us to take a really deep dive into that in terms of how we really maybe understand it and how, if we were to be able to change this thing, how will we have it change it pretty much?
Gabriel,
Yeah.
Gabriel, this is one thing sometimes we in the diaspora, people can have problem with us back home. Because at a certain point, we present the case as if those who are on the ground have no idea what they are doing. To say that this thing was just written by the US government, you have the foreign ministry involved. Even the development of the MOU was
No,
developed.
the
One
point of
second, no,
correction.
let me
No,
finish. Let me
no. The
finish.
point
Let
of
me
correction. I
finish.
think you're. I
Let
said
me
it
just
was written
one
as
second.
if. No. Let me finish. It was written as if it was just written by the U.S. government and we didn't have any input based on the
No, you
language.
said that
It's
was the
based on the
point,
language.
Anthony. You
But make
said
your point.
this. No. You presented it as a point that has been made by Anthony, and you are validating what Anthony said. So if you have an entire Ministry of Health, you have the National Policy, National Public Health Institute that is involved. You have the Ministry of Health or Ministry of Foreign Affairs that is involved. Whether all of these people have no idea what they are doing, there are some level-headed people there.
Can I ask a
So
question?
once, okay, ask me a question.
What is the current stage, or the when it talks about data, personal data protection? We know that the cybersecurity policy or laws just got passed, but when it comes to people PHR in Liberia, what can you point out to any law that exists that protects that? Since you say that we have level-headed people in the country, why was that PHR, or why is it that a data protection policy not being placed in this by the
In this,
Liberian people
exactly.
or the Liberian people? When it comes, because we can understand that they're collecting data, right? And we can understand that we will not have total access to this data, and we might not have the cybersecurity expertise to know who is in our systems at all times. But if we do discover that, what laws in our constitution can we implement and say, oh, America broke this our law, they have access to this data of our people, we can fight them on this? What is that law in this MOU that shows you that Liberians are the Liberian people at the public health ministry and also the foreign ministry? What law does that shows you that they are serious about protecting our data?
So let me clarify to you first. Whatever data we are talking about in this MOU that eventually gets reported is not PII. It's not PII that will be reported. So no one is going to go to.
I'm not talking about the report of the data.
Listen to. When you say access under the MOU, we are talking about project-related data. So the first thing in this MOU is that there are indicators in the MOU. Go to section 1 of the MOU.
Will the U.S. have access? Will the U.S. have access to the infrastructure currently in Liberia when it comes to the DHIS2?
It says that when they are doing performance,
will the U.S. have access to the data warehouse in Liberia, because they were going to be doing compliance and auditing as well too. So will they have access to that?
That's what I'm coming to. The way this MOU is designed is almost like the way the FARA was designed. That the government of Liberia is going to spend her own resources. When you achieve the outcomes that are in this MOU, the US government will do verification, and then they will reimburse you. That's the way the FARA system used to work, even when USAID was in place. So when they come for that verification, there is a possibility they will ask to see, to validate what you say you have achieved. If you say, for instance, we've tested 2,000 persons or we have done HIV tests for 2,000 persons, they will tell you, can you please show us the list? of people who came in on a daily basis. So that verification, they will see that project-related data. What I'm saying to you is that they are now going to ask you that when Anthony came to the clinic, was he HIV positive or not? And they take your name, they take your result, and they take the rest of it. When we talk about protecting PII, it's that kind of level of data that we are talking about. But we should not have concern about the data that gets reported at the project level, because that doesn't have to do with individual or personal data. This is project-related data. And beyond the U.S. government, when any donor agency, whether it's DFID, whether it's GIZ, whether it's the suites, when they provide money to you to implement project, you have to report performance data. And the performance data will be reported against the indicators that are in the project document. In this case, the outcome indicators that are in the MOU. To go back to your point about PII, we do not have currently, Liberia has to do work on this. Like the US government have all of their laws around PII, for instance. Nobody can ask for your social security number in the US and somebody take it and give it to them. It's protected. Nobody can take your passport number and these other numbers that are personal identifiers and they take it and give it to them. These are places that Liberia need to work on. But even when we did not have it, we implemented projects and then we reported performance data, which is what we will be reporting here. So this is the point I keep making to my colleagues, that the data we are talking about here is not PII-related data. The government of Liberia is not going to take your name and submit it and submit your HIV status. That's not what will be done.
They don't need to do that if the system is being built and the person funding the system has absolute access to the system. You don't need to report any data.
And Gabriel, it doesn't work that way either.
It says it right in the
No,
MOU.
it doesn't work that way. Liberia is a sovereign country. One second.
Listen to me now.
Liberia
Listen to me now. Wait.
A sovereign country that does not have this PHI. How can you be a sovereign country when you're going into?
I don't. And this is why I continue to have this point of contention. I think, and this is how we've done all of our concession agreements. We don't put things in there, and we think the things that are not in there, we're going to enforce it. If it is not in there, you cannot enforce it. If you do not protect me from getting access to those data to say you're going to fund the databases, I am going to have access to it. If you need any reporting, I can report it. I can give you the reporting. And if you need validation, I can give you access to come in the database to access those data. One second. Let me land. In the MOU, and this is what I continue to tell you, go back there. There's a clause that I forgot what page. It says the U.S. government.
If you know the page projected, let's go there.
The U.S. government will have complete. Matter of fact, they even state at all time they will have access to it, right? So this brings us right back to the point that Anthony was making, right? Unless you have anything within a contract or the MOU that said you cannot take certain data points or they can do whatever they want to do with it. And I think this is what you're saying, oh, it doesn't work that way. It doesn't work that way. Yes, we can all sit here and agree that it shouldn't work that way from an ethical standpoint. But if it is not written, you have no defensibility to defend it. That is the problem.
Can you go to that text that you are talking about and highlight it and put it up? Because the Liberian government already has these systems in place. We have system for supply chain. We have system for laboratories. What this MOU is going to do is to just help them develop it and train people. So for you to say that the US government has access to it at any point in time is not true. If for project implementation purposes, if there is a report to be made, they will go through those systems and be able to report to the US, to the State Department, because the State Department is representing the US government in implementing this MOU. So this is where I don't want us to conflict personal data with project-related data. So just find a clause and let's go to it.
Thank you. You guys go ahead. Let me look up this clause and I'll project it.
So I think my understanding of this is that
let's welcome Mr. Tao.
Oh, okay. Mr. Tao, welcome to the show.
Yeah. Hi,
Yes,
gentlemen.
sorry. Mr. Tao, welcome to the show. And hopefully you've been following us. If not,
I've been following.
okay, good. We are talking about this most recent MOU between the government of Liberia and the United States. Basically, we want to get a better understanding of what it is on both ends, from this perspective of the United States, as well as from the perspectives of Liberia. But most, as I stated here several times, the most contention point here is the data, right? That is being shared within the, uh, that is being developed. Who has control over it, right? How is that data handled? How is it transferred, right? Um, if you have had time to read the MOU, I would like to hear your thoughts on your perspective in terms of what you made of it from your reading.
Okay. So hi to my fellow panelists and hi to our viewers. Yes, I started following this stuff is very similar from from Kenya. Okay, that is
Yep.
where I started following it. Even before the first MOU was signed in Kenya, I started following this, and this is not that much different from a lot of things that the U.S. or the Western countries do in Africa. The question, and before I go into that, I will try to say this first. There was something said here that as if there was no difference between USAID and the State Department or the US government.
Mhm.
The programs they ran, that USAID ran, is a continuation of it. The USAID is an arm of the State Department, or was an arm of the State Department. The implementation arm of the State Department when it comes to certain aspects of foreign policy, which is like soft power. So it's not different. It was based in the state, so we shouldn't try to make it like they're separate. The next thing here is that where is the proof that Liberia was involved in the writing of this MOU? It doesn't exist. Just like everything else, all that we have been is we've been signatory to treaties and to agreements and to MOUs and to different things. It is the same thing. We are just continuing the same way. Then the next question that we need to ask first is, why at this time, what is the United States government's interest in the health sector on the scale of Africa? At this stage, there is a reason. Right. There is a reason. The Trump administration came to power and they said that they were pouring aid. And everything was going to be what? America first. That's very good. Every country should look out for their own interest. Then while all of a sudden, they're saying, look, now we have interest in wanting to help Africa or African countries to solve their health problem. How is that in the interest of the US? How is that America first? These are some of the questions we should be asking. Actually, before we even then approach this, what is America's interest in this?
And that is I think one of the questions I keep asking here that I think everybody keep maybe dodging is basically why, the perspective from the perspective of US, why do you think they put forth such an agreement?
Okay.
This wasn't just in Liberia, just in Kenya as well. And I believe Kenya voted that down. They never, they have yet to rectify that agreement fully. And then it came to us, and without hesitation, we're
the first country that signed it with nothing else. But Gabriel,
Gabriel, can I make a point? Can I make a point?
Let me just make this point first.
Let him land, and then you come in, Thomas.
Let me land because I was saying something, and I was asking this question because, according to the U.S. own data in their own record, right, the United States is one of the sickest countries in the world we live here, where over 50% of its population is sick. They don't even. I have an affiliation with the healthcare sector, to where they have what you call a disease management system. It's not even a healthcare system. to where they can't even help their own citizens, to where just medical bill making people go bankrupt. The US cannot help you with healthcare. So why are they leaving their people? They're talking about stuff like malaria and all this stuff. The problem with malaria, Thomas, is that it's not the lack of medicine. No, it's the condition in the country. Malaria is when the environment is not developed well, to where the infrastructure and the sanitation, all this stuff, is going to breed mosquitoes. It's like you're standing into a contaminated water that is infecting your body. Instead of that you being removed from that situation, they just give you medicine, but you're still staying in the water. Your problem is not the lack of medicine, it's the condition that you are in. So the US and the Gates Foundation, all of this stuff that run these things, if they really have interest, let's say in Liberia, for example, address the underlying issue that is leading to these things. Invest in those areas that lead to these diseases and everything else. But nobody, they don't want to address that because it don't serve the interest and the purpose. So there is a whole lot more tied to this, and as we go on, I'm going to point some of them out, and I'm going to show references, and we're going to discuss it.
Okay,
Thomas,
thank you very much. So
go ahead.
Let me come back to your original point that USAID and State Department they were more like the same. So the issue of the merger of USAID and State Department, it never started today. This has been an ongoing battle, even back in 2010, 2012, onto 2015. The U.S. State Department, there have been argument that it should be that USAID should be merged into State Department, and other countries have done it. Australia did it. The UK did it. So now we used to have a DFID before. We no longer have DFID. The International Development Arm for the UK is actually merged into their foreign policy. The distinction was that the State Department used to focus on diplomacy, and then USAID focused on development. If you listen to what the Secretary of State has been saying all along, and this is why sometimes when we come on the show, we can have some differences, because there are things that are put out there, and then sometimes we try to contradict them. The Secretary of State had repeatedly said that the US government is not going to stop aid. What they thought they were going to stop was to provide aid through NGOs. And I reference the signing ceremony of Kenya. They have said when they are providing aid now, they will provide it to the governments. They don't want these middlemen. They don't want NGOs. So the closure of USAID did not mean that the US government was going to stop aid and no longer provide aid. That is not true, right? So when you say what is the interest of the US government, this is something they've put out clearly. They've said that for them to provide aid now, it has to be in line with their national security strategy, which they just put out. Have you read the national security strategy that they put out? It is now clear from the US government perspective that if they give aid, it has to answer three questions. The first question is, does that aid make America safer? If it makes America safe, they will provide it. If it makes America stronger, they will provide it. If it makes America prosperous, they will provide it. These are the three cardinal criteria that aid has to meet. How does supporting health systems in other countries make America safer? I just told you the case of Ebola. When Ebola came, it left Liberia, it went to Senegal, it went to Mali, it went to the UK, it eventually went to the US. And in the end, the US had to send not only medicines and finance and everything, they had to send the army in Liberia to defeat Ebola. How is building a health system in other countries
How
not
did
making the US?
army defeat Ebola?
Come on, man. You didn't follow this?
It wasn't the US Army.
No, I'm coming. I'm not saying it was the
Dr.
US
Fala, you need to check
Listen
with
to
Dr. Fala.
me.
He'll tell you the true story behind that.
Gabriel, what I'm saying to you is that the US actually sent their army in Liberia to help build the Ebola facilities. I'm not saying they defeated Ebola. It was part of the package that the US government provided to Liberia. before we were able to defeat Ebola. You didn't see the U.S. Army in Liberia. So what I'm saying to you, I'm answering his question as to why are they doing out there supporting health system. And it is a very good question. Why are they not supporting education at this point in time? Why are they not supporting food security? They are choosing to support health systems in Kenya, in Uganda, in Rwanda, and Liberia. Liberia is celebrating in West Africa to say, oh, we are the first that signed the MOU. I'm saying we are the first that signed the MOU simply because of our traditional relationship with the US and maybe the Ebola history that we got. It's not because we have a special place. That's why we are doing it. So I just wanted to answer these questions that you posed, and then we can move forward.
Okay, so let me go to one of the pages that I highlighted here. So page 15, section 4.7, right? It said the effect of failure to fulfill data sharing commitment, right? It's within the MOU. It said Liberia acknowledged that so long as the US government is providing any funding assistance, funding for activity contemplated under this MOU, the US government has a significant and material interest, not just significant, but material interest in ensuring that Liberia fulfill all commitment in the data sharing agreement referenced in section 2.12. Right. Now, what are the criteria in section 2.12? Let's run right back to it, and I would tell you. Section 2.2. Okay, implementation. Right. There's a slew of things here. The U.S. government plans to leverage past system assessment and analysis of prior outbreaks to respond in Liberia to inform operational planning, right? From the 4.7 that I read, it gives them 4 assets. That's the point that I'm trying to make here, right? Not only that, it gives them access to the previous system, any old systems they had. So when people are saying that this is a 4 asset, you keep saying this, oh, they're just going
No, Gabriel, there is a difference between system and assessment. They said they will leverage the previous assessments that have been done. The DHS that has been done in Liberia, it got data. The assessments they did on Ebola, it got data. So there is a difference between assessment and data that you get from systems. Don't say that.
Mr. Connor.
Go ahead. No, let's let
when you read section 2.52 under data systems, right? And Liberia, like it talks about Liberia commits to ensure that all data systems used to collect, store, and transmit data under this MOU are compliant with international data privacy and standard and security standards by the end of 2028. So when you look at that word data, will you still say that that's performance data this is referring to? You're muted.
No, read what you read.
Look at the word data in 2.52 under data systems. Would you still say that this data that they're referring to for the international data privacy and security standards, would you still say that this is performance data they are referring to here?
So let me be clear to you now. Under this project, the government of Liberia will be collecting both project performance related data and PII. Because if you go to hospital, they have to collect PII on you, right?
Of course, yes.
They have to collect your name, they collect your blood sample, and they do a lot of investigation on it. The point I made earlier, and I continue to make to you, is that the reporting that is going to take place under this project. 1 second, I come to your question, listen to me. The reporting that will be done is against the indicators. And if you go to 2.1, the indicators are there. The government of Liberia will hold your PII and aggregate the performance-related information and provide it to you. The point you just read, it commits Liberia to data protection based on international standards. And whether it's
what data protection? The PII.
One second. Whether it's the WHO standards and other related standards, PII is something that is protected. So this is why I keep saying to you guys that the government of Liberia, through the Ministry of Health, It's not just going to take personal information and dump it to the US, because there are already data protection guidelines in place that the government will have to adhere to.
Thomas,
So you collect all of the data, but when it comes to reporting on the project, you report aggregate level information.
you are missing the point.
just
Even if you're reporting, they already have access to the data point from them.
They don't have access, Gabriel.
do.
This is what you keep saying, which is
Listen.
wrong.
Yeah, are
It's
you
wrong. So if they have access,
are we reading the same agreement yet? Are we reading
if
the
they
same
have
agreement
access to all of the data, why do they need access to the system during performance audit? Go to the section on performance audit.
Can you verify? That's why I've been asking you this question, right? The
I think
U.S.
we read this.
How will the U.S. make the system better if they don't have access to implementing the system?
They make the system better based on what you report from the system. So for the instance,
How?
You are telling me that they won't have access? I'm not sure if you know how technology works, but in order for me to enhance the performance of a system, I will need complete control over that system.
It doesn't work that way. This is not only technology.
Why
this
do you
is
keep saying it doesn't work that way?
If
This
I
is how
want to
data
make
works.
if I want to make your data better, I will need access to your data. What is it that you're not understanding?
No,
If
it doesn't
Thomas,
work.
let me
Anthony,
let me give him a perfect example. Let me give you a
Gabriel,
perfect example real quick.
Gabriel,
So right now we're having
Gabriel,
quickly,
Gabriel.
wait, you're coming. Right now we're doing audit, right? At where I work, we're doing audit by one of the big four, right? Those people do not have access to our banking system, right? They don't. So they come in, they have we give them file, they said these are this thing we want to look at. So okay. In order for them to physically go in to access those things, we have to give them access, restricted access, right? If they look through those things, they don't find what they're looking for. They have a point of contact, say, we're looking for such and such and such. We can't find it. Please provide it. That's different from what is laid out in this MOU. In this MOU, they are funding the building. They even said they were even going to bring in consulting contractors, and those people will get paid.
Hardware and software engineers as well too.
So it's full access they're being given. If I build something, I have access to it. I can't just turn it. So this is where my third point here, intellectual property. There is nothing in that clause.
Nothing.
I talk about intellectual property. Who owns it? And you keep saying, oh, it don't work that way. It don't work that way. I understand. But contract don't work that way. If it's not stated in there, you cannot defend it anywhere in international law or even domestically. That's the point that we're making here. Go ahead.
Let me hold on, Mr. Thomas, hold on one second. There's this term called, there's not the term, but there's something called differential data, right? Differential data means that you can have my name, but you cannot have, certain particular information about me that can make you to create a profile on me. That is what this MOU should have focused on as well. That there should be a differential data that where people will have access to say that, okay, we know that 45,000 people in Liberia, 36,000 people in Liberia have HIV, but we don't know their particular address. We don't know their phone number. We know their first name, but we don't know their last name. These are things that we should implement in this MOU that I'm trying to make you to understand. Without these things, the United States government they will have access to all these information.
Anthony,
do you want to know why? Do you want to know why? Do you want to know why certain documents you get back, they only give you your full last detail of your social security number and not the full?
Anthony.
Yes, sir.
When the National AIDS Commission recently reported that there are 31,000 persons in Liberia that have AIDS, 36,000 persons in Liberia that have AIDS, do you know where these people live?
No.
Do you know their names?
No, but they show certain.
That's what I'm saying to you. The data that gets reported.
Why is it not in this? Why is it not in this MOU?
1 second now. And you took all the time to speak.
Take your time as well.
Liberia is a country. It has systems by itself. The National AIDS Commission goes out and collects a lot of information. They test people. They know who has AIDS and who does not have AIDS. When they come to the public, they call the number. And this is why I'm consistently saying to you that the report that goes against HIV reporting to the US government is going to be this aggregate level. Go to the indicator, number of people who have been tested. The more that number increases, the more we know that the government of Liberia is doing well to be able to reduce AIDS. Number of transmissions they have been able to stop between the mother and the child. So these are aggregate level numbers that get reported to the what? To the US government. The PRI that will be there, the people need where to live and all of that. That's not what you take and give to another government. This is the point I keep making. And if you go, one second. If you go to section, here is the line. I think it's section, let me read the section to you. 2.5.2 under implementation plan.
Yes, sir.
It says, the United States and Liberia intend to negotiate a data sharing arrangement that includes the elements set out in Appendix 5 for the purpose of exchange data on long-term performance of the MOU and for accountability to the US Congress. So if all of the systems that are in place already, the US government got access to it, so why do they negotiate a data sharing agreement? If everything you are saying, they build a system, they have access to it, why do they need to negotiate a data sharing agreement with the government of Liberia?
Can I speak? I listen to you, and I will answer your question.
Yeah, go ahead, and I'll let.
Look at what happened here.
Right.
I don't know because I come from the science background, and I've done research, and I've collected data, and I've analyzed and done all of this stuff. There is no difference here. The U.S., because I read portion of the MOU, like you guys are mentioning now, where the U.S. is going to be the one responsible for both hardware and software. They're going to design the database. They're going to pretty much have contractors. They're going to have access to the full data. All of this stuff about writing in about your aggregate is the formality of it. Like Gabriel just said here, I have my organization that will work through certain databases. And something went wrong with our account. But the people on the other end from the tech support try to check. But in order for them to actually be able to check everything they have, I have to give them like an admin stuff, and they were able to get in there to see everything that I do and that we do. Down to everything. When you read that stuff, the US have that much control. But look, let's just say it was just aggregate data for this argument, which is not. It's the full data. The US is looking to have access to this full data, and there's certain reasons why, and we'll come to it in this particular discussion. But let's just say the aggregate. Let's just say the aggregate data.
Your line of argument is that any IT firms that build a system for a client, that IT firm has full access to your information and your data.
Yeah,
that's what you guys are saying. That's what you guys are saying. That for the fact that the US government is listen. You have many big IT firms. You have many big IT firms. Listen, 1 second. You have many big IT firms that come and build a system, a financial system for a bank. When they are finished, you pay them off and they leave. You get password to the system. So what you guys are saying, listen, 1 second.
There is not a law in Liberia that's forbidding the U.S. from doing that. Can you get that?
The MOU forbids them.
My man, now I want to believe.
So what you guys are saying is essentially that anytime you build a system from someone, even after you've completed building the system, you have full access to it.
Thomas,
is that what you are saying?
I'm not a tech person.
And the U.S. government is funding. The U.S. government is funding the improvement of these systems. These systems are already in place.
Who are tech people?
So I don't know how you're twisting all these things.
If you enter into an agreement with somebody to build a system for you, within the scope of work, there's also going to be a
Security.
transfer of intellectual property. Meaning, if you build it, that everything that I've given you to build it, or whatever you build during that process, you have to turn it over to me.
Turn it over.
If it is not in that scope of work or the definement of contract, you don't.
It doesn't
You
exist.
can run it. I can give you the password. You can run it. But anytime I want, I can go in there and break it down and take anything I want. Until you see that in the contract, you cannot say, oh, things don't work that way. And this is the point that we'll continue to make here. Instead of saying, yeah, there's this reason of concern here, you're saying things that are out of the contract. They're not technically, if I build it for you, I'm supposed to hand it over to you, your password and everything to give it to you. But if you don't state that within that intellectual property belongs to you, that means any information I given to you or you develop as a result of this contract, that you build it, that it belongs to me fully, that you need to turn it over, you don't have to. And I can take you to any court.
Gabriel,
I can take you to any court, and you'll
As
still
long
win.
as long as that law is not, as long as that law does not exist.
I keep making a point and you guys don't get it. You
What's
are
the
not
point you're
getting it.
making? Okay, make the point again so we can go on to
The
the
MOU got different sections, right? You are stuck on the systems. Like I said, the MOU got different sections.
Agree.
On laboratory systems,
Agree.
on the maternal mortality. They are even going to help to train midwives,
Agree.
traditional midwives.
Yep.
They are going to help to train community health workers and all of that. What I said to you is that some of these systems that the MOU is referencing, the supply chain system, the system for laboratory, they are already in place. Go to the MOU. It says Liberia already has these systems in place. The only thing this MOU is going to do is to help to improve them and then integrate them. So that when you are working on laboratory issues and you need data from the hospital section, you can easily go to a centralized system and be able to have access to that
Which
information.
will be the DHIS2, which will serve as the data warehouse. Correct.
That's what I'm saying. So these systems are already in place. The way you guys are presenting it is that because the US government is funding it, they are going to build it from scratch. It will be owned by them. Anytime they want to go in there, they can go in there. It doesn't work that way.
What?
These are sovereign country systems.
EMR.
These are sovereign. Let me finish now. These are sovereign country systems. They are already in place. For the fact that you are coming to enhance them, it's almost like our tax system that we have. Not because the World Bank gave us a grant to improve our tax system, then the World Bank says it's for us. Anytime we want it, we can take it from you. So these are enhancements that will be done. They will train people to be able to improve this system. The Ministry of Health, the National Public Health Institute, they are the custodian of these systems. And therefore, any data that comes from that system, they have to sanction it. It's not that somebody is just going to sit down in Washington, D.C. and log onto the system and just take any data that they want to take from there. Why don't you guys get this?
Okay, so Gabriel, I was
ahead.
speaking and then you came in, but look.
Sorry, go ahead.
Thomas, you're looking at this stuff, and I don't think we need to refer to history. Okay.
Thank you. Yeah.
This is not just something that they put a plain stuff in front of you and how they explain it, and you just think that's what it is. You know, it's not that. From this stuff, I didn't see anywhere in there where it said that this system, because from what I read, unless I missed it, to whether the system that being constructed in the agreement that it belonged to Liberia. No, it didn't say that. I didn't see it.
You have not read the MOU. No, don't waste my time. You've not read the MOU.
Allow him to speak.
No.
Okay,
Let him go read it. He said it from the beginning. He said he only read snippet of the MOU. Read the full
I said
MOU.
from what I read.
On the show.
That is why I'm saying I
Don't
didn't see it.
Let him
see
speak.
it so you can point it out. But we know that the US, as a bigger country, more powerful, with the interest that they have. You think the US is just going to wake up and spend almost $1 trillion when they can't even help their own people running across Africa? You mentioned Ebola. Have we actually, as a country, discussed how Ebola came to Liberia? Because this stuff, it has something to do with this.
That's why I'm saying to you, when you were asking the question how it benefits the US, that's why I said to you. So you
No, you mentioned Ebola. You mentioned Ebola. have we asked the question how Ebola came to Liberia? Because the lie that they told, listen
you don't
now,
have the
listen, the
capacity
lie,
to answer that
listen now,
question.
the lie they told was that some 5-year-olds in some forest in Guinea ate a bat, which you know is a lie. Virologists and everybody have proven it, that it can't jump from animal to human like that. And how many Liberians go in that village that they show up? Straight in Monrovia, that some lady that was in at the border drove and all of a sudden the whole Liberia in flame. There have been reports, there have been conferences, there have been leaks. Now we can debate that everywhere where the so-called Ebola took place was a biological weapon lab of the US. It didn't go far in Guinea because the Guineans recognized it very early on. They drove the Red Cross and those guys out of there, and they died down. It's all Liberia. Anything the white man preserved the whole Liberian population. And up to today, we never asked that question. Now it brings us to looking at history, Thomas. Go and look at the Tuskegee experiment. Go and look at the experiment in Guatemala where the US are able to collect the same kind of data and then use that biological warfare for them to destroy a whole bunch of people. Let's look at
in Kenya too.
And now, yes, and now this is let me put this way. Like Africa right now have estimate about 1.5 billion, 5.5 billion people. The population in the rest of the world is declining. Africa is the only area, and from you guys work with the UN from the data, it's been projected that by 2050, Africa will move from 13% of the world population to almost 25%, about 3.5 billion people. That so then, what is happening here? What have been the struggle? Yeah, what have been the struggle? When Bill Gates, the United Nations, the same USAID and the US government are crying out about population being out of control, they always point Africa out. But what is happening when they want to control our population? In the US, I live here. I don't know if you are here. They're paying their people to have children. The child tax credit. China, everybody doing it. But so if the population is so much that it's an issue, why are you paying your people and you encouraging them to have more children? But when they come to Africa, you want it to reduce. So Thomas, this is what we have. And it doesn't matter what you say that, oh, it helped 1 or 2 people here. But if they want access to your genome and all the stuff, you can say, oh, no, they don't have the data as aggregate. But they have the whole thing. But let's just say it's aggregate for this. If they collect and they say in this country, in country A, there are people they have 5 million people. 2.2 million people are susceptible to this kind of disease. They not Nemo, but just that number. So amount of people have this kind of disease. Do you know that they have a research that they work on called gene selective research, where based on the genome of a certain group of people in population, they actually tailor viruses and diseases. Do you know one of the intentions that they have is to try to stagnate and destabilize the rise of Africa by targeting population with germ warfare and other stuff? No, they've done it. So we have to look at the history. So at this stage, why do they need that? What happens if you give them all this information? They have access to your population. They're the one bringing in vaccine. We're talking about malaria vaccine. You guys from that particular background, but nobody say, how did the malaria become so resilient and resistant? When Bill Gates said that by releasing mosquitoes that were put in the lab here, is that what we needed into the population? Now, this stuff explode. The same Bill Gates turn around and he bring in vaccine that he's selling. But you see the whole thing where this is going. So you think from all these records we should not have concern. So it's not about the found data, Thomas. It's not about the found data and the process that you're explaining.
Let me add one point. Let me add one point to what he said. Perfectly, in Kenya, they were giving people what we call tetanus shots, right? Tetanus, what you're supposed to take you take it last 10 years, you go back again, you take it every 10 years. But in those tetanus shots, they were laced. They were laced to sterilize women. And some Kenyan doctor ended up testing the tetanus shots. They stopped that. So the concern here is the backdrop of historical context to that you have to add to that, as opposed to, oh, everybody want Liberia to do well. We want our system to improve, right? But do so with complete control over your data and the protection of your citizen. Anyway, Anthony.
So this is where
Thomas, go ahead, and then I'll go.
Yeah, Thomas, go ahead, and then
this is where, Gabriel, when we come to these kind of discussions, I love us to layer it. Let's look at the literary text in the MOU. We discuss it, and then we can go and discuss the context. Then we can go and discuss some of these other issues that Mr. Tao is discussing. It is not that I don't know the history. I know the history of all of these have related things that have happened. But my point is, don't bring a theory in the MOU that is not part of the MOU. At least when we say, let's get to that point, then we can get to the point. But we look at a text that is written in the MOU. The text does not say that you are going to provide personal data. Even when you are discussing about genes and other things, you can only be able to access that information when the specimen is given to you. If they take somebody's blood in Liberia for malaria, and that blood is not given to you, the only information you get is the number of persons who were tested for malaria. How do you use that number of persons to do all the genes that you are talking about outside the specimen? So this is what I'm saying, that much of the data we are talking about in this MOU and the indicators that are there, maternal mortality, child mortality, number of persons that get tested for HIV and AIDS, number of persons that got malaria bed net. These are not data sets that somebody is going to take to be able to have access to your blood specimen that is in Liberia. These are different levels of things. So this is why I want us to be very careful when we discuss data. Are we discussing project-related data? Are we discussing personal data? Are we discussing specimens that will be collected by the health centers? Then we can go into the argument. But to just have this knee-jerk reaction, and this is exactly what also happened in Kenya, and by the way, it went to the extent where the court even came in and said to the government, stop, don't go ahead, because people got on social media and said, oh, they're collecting all our health information, they're sending it to the US. And it became a problem. Now the president has a challenge of explaining to his people what is in the MOU, because Kenya quick to demonstrate. So this is why I say we have to be careful about the way we discuss these things. What data are we talking about? Because our people who follow us, little thing they hear, they will take it out of proportion and then they carry it out there. No. This has been my whole issue.
Okay, look, let me Anthony, before you come in real quick, just like 10 seconds. Thomas made a point that if they don't collect the actual blood samples, that how would they have that's for genome? Thomas, they don't have to have the individual blood samples. You think they're going to go ahead if they need to do 5 million people? They will go ahead and do no. That's not how it works. All they need to know is people in this demographic, in this race, have this kind of majority that have this illness. Based on that, they can code and see the gene that make them to be susceptible to that. That is all they need to know. So they don't even need to actually have the aggregate data is enough. It should not be turned over to anybody. Nobody should have access to it.
Mr. Tao, all that you're discussing is in your demographic health survey. So if they need that data, they already have it.
Okay.
How does it matter? Have you read the demographic health survey?
Can I come in, please?
Have you read the demographic health survey?
Thomas, let's allow Anthony to come in.
I would like to talk about a question here that someone in the chat had posted. So Liberia doesn't have privacy policy, and is that what you guys are saying? Correct. There is not a data protection policy that is in the Liberian constitution right now, and we still deal with the constitution from I think 1986.
1986, yes.
So the point that I wanted to make is that this is a memorandum of understanding, MOU. So we need to look at the U.S. role. The U.S. role is specifically to assist with funding and also technical support That technical support includes both software and hardware. So what I want for people to understand is that if I am supporting you technically and I have both software and hardware, that means that I will need access to your hardware and your software. And if I am assisting you, whether it's by moving to the cloud or building additional physical hardware infrastructure, I will need access to that as well too. There is no way possible how I can assist you software and hardware and then not have access to your infrastructure. Whatever infrastructure that exists, which is the DHIS2, the data warehouse in Liberia, which will be serving as the data warehouse in Liberia, I will need both hardware and software access to that. That's what I want for Mr. Thomas to understand. Now, is there a portion in this MOU that states that for the Liberia part, that Liberia will hold its end when it comes to the protection of their people, PHI or PII? No, it doesn't. There is no clause that explicitly prohibits the U.S. government from accessing any data. So this notion that we're trying to come on here and talk about how we're trying to come here and undermine the Liberian government is not true. What we want for people to understand in the several ministries that are part of this MOU is for them to go back to the table and say, okay, we need to explicitly say this, or we need to wait until our data protection policy has been passed. There is no way how a Liberian person in the health ministry or the foreign affairs ministry can read this documentation and tell me that they have explicitly said that America will not have access to this data. Even if we're adhering to the international laws, we still need our own national laws to say that. Just in case the American government says that they're not adhering to the international laws, we have our own national laws that we can say that, okay, you prohibitly undermine this MOU, and that we should go ahead and look at this MOU. Now, when this thing comes to actual implementation and to try to put that agreement down, I hope that our people can understand and can put that in place. There is nothing, I cannot put anything past the United States government anymore.
Unless you don't.
And neither can I put anything past the Liberian government.
Yeah.
But they need to show us that they care about us.
That's the whole point of the argument.
Can I make a point?
Laying that out. Yeah, go ahead.
So I lived my whole life providing technical assistance. You don't got to lecture me about when they say providing technical assistance.
Were you the one paying for that technical assistance?
1 second now. Yeah, answering your question.
I also asked you, because I'm not talking about technical assistance from a standpoint of like you just go in and provide that technical assistance, but you are actually funding that technical assistance. Were you funding that technical assistance?
So
because that's what the U.S. is doing here. But go ahead.
So historically, the U.S. as part of its development assistance in any other development agency, you provide funding, you provide advice, and you provide technical assistance. You get that? So whether this funding was provided by DFID, they will do one of these three things. They will either give you the money, you do what you want to do with it, or they will provide you the money, they provide you advice, and they provide you technical assistance. But that technical assistance can come in different forms. That technical assistance can be if we want to upgrade a data system that is in Liberia like DHS or DIS. We will hire a firm in Liberia to be able to help the Ministry of Health to do it. That's part of technical assistance. So you are going to hire your own firm in your country to do the work. If you don't have the capacity in country to be able to do it, you can hire an international firm. In some instances, it will be a U.S. firm. This notion also that it will always be a U.S. firm, like I told you, the Secretary of State has said that they want to get away from this middleman. It could be the case that they will hire firms either from Liberia, they could hire a firm from the region.
No. It states explicitly in the document that there will be U.S. contractors.
Okay. So even if they are U.S. contractors, when they come to build the system or to upgrade the system, you have to give them access. They will upgrade it. If they do it for 1 month, 2 months, they are gone. When they leave, They no longer have access to your system. You change the password to it.
All laws are binding them by that.
When they come to do that piece of work, there will be a contract that will be signed. You will give them a scope of work that this is what we need you to do. Upgrade DRS, improve the system, improve the interoperability between this system and that system. When the work is done and they are finished, they go away. They no longer will sit in Brussels and have access to your system. This is the point I keep making to you. I already said earlier to you, even in the chat room, I had said earlier, we passed a cybersecurity act. I'm not sure whether it covers the issue of protecting PII. If it does not protect it, then that's a gap that we need to work.
There is currently a data protection law, like I stated, law that's on table.
That's something we need to.
That should have been passed before this MOU should have been signed.
That's a limitation. Even in the chat room, I said, okay, as a country, this is a limitation that we have. Like, for instance, we are signing PPP contracts with people to come and build room. We've not even finalized the PPP policy, right? So these are limitations that we have as a country.
But do you see that as an issue for another country to exploit? If that is not,
that is the point that we're trying to make here. But he
that is an issue for another country to exploit if that is not instituted in Liberia?
In the absence of those laws, the responsibility is on the Ministry of Health, is on the National Public Health Institute.
That is a simple yes.
To make sure that private data is protected. And like I said, it will not be private data that will be protected.
Under what laws?
There are policies in place, my man. It doesn't have to be a law.
Dude, let me read you another clause in this thing to tell you that there's also a tax exemption. That tells you, meaning they're trying to protect the contractor that will bring into the country to work in this country, right? It said, this is section 2.7, right? If you want, you can go back and read it. It says like,
no, Gabriel, we shouldn't read that. We shouldn't read that. Development projects are normally exempt from tax payment. You should know that.
No, because you were making the point that they will hire people in Liberia, and no, these people are bringing in their own contractors and even subcontractors, right? Everything that they not only tax exempt, they want duties free if they're bringing in any equipment, hardware.
That's why I'm saying to you, Gabriel, when USAID was in Liberia, all the vehicles that were imported by USAID employees, they don't pay DT. That's why I'm saying to you, whether it's DFID, it's EU.
It goes back to the point that we're making. That you were saying, oh, they have to hire people locally. These people are bringing in contractors, right? That are coming to do that, right?
No,
but the only job creation.
That provision does not mean that 100% of the contractors will be brought.
No, I didn't say 100%.
If it is one, even if it is one, then you have to give them the duty waiver.
Okay.
And the thing that is really surprising me is that these are common practices with international development aid.
And that is the problem.
Accept common practices as a 178-year-old country, Thomas. Like this thing, oh, this is how it used to be done. This is how it's done across the board. Like, no, this is 2025.
What do you mean? Somebody giving you free money, you want to tax it?
The money is not free. Let me ask a question.
It's a grant. It's a grant.
It's never free. It's never free. They take from you more than they give you. You know, this is capitalism. In a capitalistic system,
there's no such
thing
as
$1 billion a year in taxes. It means you already made about $100 billion for the system. So it's never free.
The flavor of
no.
this.
No, let me ask this question.
The flavor of this money is a grant. Okay. Whatever they get from you through your natural resources and other things, these are things that we understand. But the flavor of this money is a grant.
Yeah, Thomas.
Okay.
We know what the U.S. grant is like. But let me ask this question. They told us that they have put almost $1.5 billion into our health system, USAID, from 2013 to 2016 or something like that. Look at the health system. Let's see where it actually went. They say from 2005 or 6 to 2012 or 26 or 15, they put almost $1 billion in our agriculture. Tell me if you can. So it's not about us just reading some fine documents and some stuff that implementation, all this stuff. Let us look at the outcome, the end result. It's not working. It's the same thing with this. But let me ask this question. what is the actual fight between China and the US when it comes to chip and when it comes to making stuff in electronics and phone and all this stuff? Even though the phone is sold, because whoever the country that is actually providing the software and the design and everything else, they have the ability for them to create a backdoor so that information filter through. So
will not accept that.
You can say all of this stuff. We know the US is very good at the guilty of it. They've been caught many times. So then you are telling me that small country like Liberia, they're going to provide the money, bring their own people in, set up the technology, integrate your system, and they come and they sit down. And you don't want for us to look at it from that angle. We should just look at it from something because you believe the U.S. Secretary of State, that you take him at work at face value, that he said this.
Here is the point.
I
have said repeatedly that if you don't take aid, you don't have to report. So we have a choice.
But we don't need it.
One second. Do you know the progress that Liberia has made from 2005 to now in terms of institutional capacity building, in terms of infrastructure and all of that? So that question you're asking where that money went or where that money, the roads that you have, the institutions that are in place. When the Civil War ended, one second now. When the Civil War ended, did you have NFIL, the National Public Health Institute?
What does that
Do you know
mean?
how it was built? You don't know why it does? That's because you don't understand the development nature of the country. You don't know what NFIL does?
Thomas, it's not that I don't understand
It's
it.
not
But
about,
what is the actual impact?
Keep on that path.
What is the
Keep on that
actual
path and
impact of
explain
this
what it does.
that you are mentioning?
To dismiss somebody
So
and say, oh,
the National
they don't
Public
understand,
Health Institute, the National Public Health Institute was established when Ebola left the country. That we needed to have an institution that can do public health diagnosis to be able to identify epidemics, to report them and fight them. Because when Ebola came, it was only the Ministry of Health. And to an extent, the Ministry of Health is more like a clinical institution. They weren't doing research. Like you asked the question originally, have we been able to identify the cause of Ebola? We've not still been able to identify it many years after Ebola came. So when Ebola, listen. So when Ebola came and left, that's how our friends and everyone came together and said we need a public health institute to be able to let MPOX, the MPOX that we have in Liberia now. It is the NFIL that is doing the investigation. They do go and take the samples and test it and do everything else. So what I'm saying to you is, when you ask the question about all the money that has gone into Liberia, like before Ebola, we never had public health assistance at the community level that we're working. When Ebola came and left, we realized that Ebola could not only be defeated through a clinical means because there was no medicine to treat Ebola. Ebola could only be treated or defeated through practices that we had to change. The way we handle dead bodies, the way we interacted with shaking hands and all of that. So when Ebola left, there was a community health policy that was developed and they started the implementation. Now you have people at the village level. They move around. When there's a little case, they take specimen, they send it to the reference lab at Enfield. They do the testing and all of that. So a lot has gone into really capacitating our health sector to do what it does today. You know that we did better with COVID because of the experience we had with Ebola. This is why I don't want, we just come on these shows and we just dismiss everything like people don't know what they are doing.
No.
That's something that for me, I don't like it.
You are misconstruing everything that we've said.
Gabriel, let me ask you a question.
Ask your question.
You pointed out one institution, but let's look at the whole healthcare system. So almost 1.5 billion, according to themselves, that were put in the Liberia healthcare system. And what we can point out is the National Health Institute.
I just gave you one example.
Yeah, okay. So you said the roads and all of this stuff. If we take everything and quantify it, you're talking about what? They themselves are calling over 3 billion.
Do you know that Liberia never even had a central system to this for drug distribution, right? USAID had to help Liberia to build a place where there is a central warehouse where all of the drugs in that country is stored and then distributed from there. Did you know that?
Yeah,
We
and,
can-
and, and, that,
Liberia
and that
never had
central
it.
warehouse.
We can-
Thomas, those things that you're pointing out, they're midgets based on the kind of money that they say went in there. They're midgets. No. Let's be realistic here, because we shouldn't just point stuff out. Okay, let's look at something here. The U.S. allegedly brought almost $4 billion in the last like 25 years that the city put in, and always their aids are all going into areas that you can really quantify. Then let's look at China at that same time. Whether aid and grant, grant or aid and loan combined, but the West almost $5 billion or more. Let's look at China. Aid and loan combined is not even up to $500 million. You see airports, you see highways, you see hospitals, you see roads, you see water system. You see actual tangible, you can quantify it. So they're trying to bring alleged $125 million, $24 million. They want to put it in the same kind of secret area where you really cannot quantify, you can't see anything. So look, let me tell you something, Thomas. I'm sorry. The West, if any country that want to actually move forward now, you cannot take the West that seriously. They can't even help themselves. They themselves, they're struggling. Liberia does not need this kind of aid. I came on to FOL 2 years ago, and I was very critical of USAID and the European Union for subsidizing Liberia's budget, for trying to do the same thing in the same health sector that they say they're coming in, and for in agriculture and education. I was vilified as a radical. I told them that what they did was they're encouraging corruption. They allowed you guys to take all these salaries and benefits, and they told them don't worry about it. Why did they take interest in this area? Because any nation are supposed to really function. Those are the three critical areas that you're supposed to handle. They wanted to handicap us. And I said this, that the day they will decide to pull out, the whole system will collapse. I was told, Jerome gave me, they listened to me, Dennis, them, I said that they vilified me. What happened when they pulled out? It collapsed. It's the same thing. That is why the U.S. does not invest into areas that move a country forward in any tangible way. Let me tell you something. Most of the so-called sicknesses in Liberia and all this stuff, they need to fix the country, the poverty rate. And how do you target these things? Improve the economy, force those people to cut the salaries, let us take control of our resources and start adding value to them. Once people start to make more and they start to eat well, let the agriculture sector improve so we can produce our own food. But that doesn't serve the interest of the U.S. because why? They need to sell you their junk that is making everybody sick. So we don't need this grant. Let them go back and do that budget over. Put money in there. We don't need money. What is $125 million or $24 million? We don't need it. We don't need it.
So I can really admire you can talk with confidence as if whatever you are saying the other people don't know about it.
It's not that they don't know about it, but it has to be re-echoed. It has to be echoed and echoed.
What you are saying? No. I'm coming. What you are saying was a major criticism of U.S. government aid, because, for instance, in Liberia, even when they did the constraint analysis in 2013, two binding constraints were identified. The two binding constraints were roads and electricity, right? It was only through the MCC grant that the U.S. actually invested in our energy sector. But the U.S. government, as a matter of policy, they never invest in building quota room for you. They don't do it. So the money was going to democracy and governance. It was going for media. It was going for women empowerment and other things. But the point I want to draw your attention to is that if somebody was doing that for you, what stopped us over the past 20 years from taking our own money that we collected through the tax system to put it into roads?
That's a whole different conversation.
That's the point.
That's a whole different conversation.
We don't supposed to be blaming other people that came to come help us.
You know where we blame them? This is what we blame them, Thomas. If you came to me let's put this in context. If you came to me and you said, my brother, your family house, or they don't have food.
Let me give a better analogy.
No, he's still fighting. Why is it that Rwanda got the aid that you got, but Rwanda is more developed than you?
Yeah, but this is the point that I'm making.
Because
No, that's not the point you're making. Why is Rwanda developed than you?
Allow him to land.
I'm trying to make this point.
Right.
And that is where Rwanda handled it differently, right? So if they're helping you, right, as you said, which I really don't think it was a help, because if you understood what went on for which USAID was dissolved, the amount of money that was siphoned off and laundered amongst them, and barely nothing reached the areas. That was one of the reasons. That is why the U.S. government decided that they would handle it and remove the middleman. So the kind of money that you're listing didn't make it in there.
Can I answer?
Because $1 billion alone would change the entire health sector in Liberia if they actually implemented it. So no, it didn't go there. Okay, but let me just end, Anthony. But if the U.S. is helping us to say, okay, we're going to help you on your agriculture, let's just say, then all of a sudden the senators decide that they're going to pay themselves more than U.S. senators make here. If the U.S. were really serious, they're supposed to say, no, you're not going to do that. If you do that, we're not going to help. We are trying to do this so that you put this money here for you to build these other things. But you see, the U.S. have no interest, like you said, because it don't serve their purpose. What happened with Rwanda, as you're saying? When they decided to give them the same grant, the government actually invested in their people. So it's a whole different ballgame. So yes, we hold our own people responsible. But then if the U.S. is looking at it and seeing it, everybody's seeing it, and they still decide to subsidize, it means subsidizing corruption. That is where we blame them.
That's where you are getting it wrong.
The people, yes.
That's where you are getting it wrong.
Anthony.
So he asked a very specific question, but let me answer that. The kind of loans that, or money that Rwanda got is not in its context as to what Liberia is getting. Rwanda is getting loans for infrastructure-based things, whereas Liberia is here getting loans about democracy, to improve democracy structure, and things that don't bring real tangible results to actually alleviating people from I would say the poverty that we suffer from, right? But to go to the point that we are all trying to make here, what we're saying here is that there is not a specific section in this MOU that points to Liberia's law or policy that dictates how America will have access to this and actually prevents America from having access to this. And if America has access to this, how we can fight them from from retaining access to these information that we will be collecting. I can assure you that within this MOU, America will have access to the systems that will be built. They will have access to the data that Liberians will be entering, like any hospitals will be entering into the system. They will have access to the data warehouse. So we will need, as a country, we will need to understand that we need to make our own laws when it comes to data protection, when it comes to PHI. We will need to pass these laws before we can enter this agreement and make this a project to be implemented. If this project is implemented before any laws get passed, this MOU and that agreement will not adhere to any Liberian laws. I am very sure of that. Yeah. And all this MOU points to are just laws, international laws, and then also you hear about what America is saying in this MOU. If we fail to give access, whether it's performance data, if we fail the whole MOU, it will not go through. That is what they're saying. So, for example, if this passed and the agreement is passed, and Liberia comes and say, "Oh, I think we should visit our data policy. We actually passed a new PHI, and we want to visit it and include it in the MOU." America said, "No. we will not adhere to this MOU here that you want to draft up, and that is true. So that points to that actually points to a critical point in this MOU. It leaves us that, from the look of it, we didn't participate in the structure of this MOU at all. Yeah. Because there's not a single point in this MOU that says that Liberia, America will adhere to this from Liberia. It doesn't say that. MOU is supposed to be a point of understanding. Even though America is giving most of the money, but we're also contributing to this. But we will be reporting to them. But in our report, we're not clarifying anything that, for example, let's say we don't have a point in this report that says that Liberia can refuse to give up any report, well, any data for that matter. What it is, we don't want to give our data. We are a sovereign nation. For example, if we collect 36,000 people that says that they have HIV, and we said no, we don't want to give this data to America, we will be forced to give this data to America. All right. Whether it shows PHI or not.
But that's the point
and again, that is
Gabriel.
No, let me come in and then you can come in.
Yeah,
right.
Come.
And that is for me, Anthony, thank you. I think you pointed that out clearly. For me, there are 3 points of contention. We're not saying we're against this thing in its entirety. We're just saying fix the problem that exists within it. Then either amend it before you sign it, and if you don't have data policy on the books, implement something before you rectify this agreement. The second point for me is the amount that they're paying. If you break this thing down, that they're paying for the contract, I think it's too small of a fee. Granted, it is a grant. If you look at other countries, it is very small. If you break it down, it's $6.29 for a whole year for one person for data point, right? I don't think that makes sense, right? So we are not in generally just casting a blanketed, refusal or rebuttal to this thing. We're just saying there are lapses within this thing that need to be fixed, right? Loopholes that need to be fixed. Allow them to identify that. Listen, I will say this and I will turn it over to you. You keep saying, "Oh, there are not, what would you think that there are not level-headed people within the Ministry of Health?" I deal with professional at the highest level all the time. You will see people in the highest level and you will think you will attribute the higher respect to these people, right? Including some of the biggest tax firms in the world. Until they start submitting their stuff to you and you start reading over it, right? This is when you realize there is economists, then there is an economist. There are teachers, then there are teachers. There is CPA, then there are CPA. Meaning you cannot just attribute or allocate that much credibility to those people, right? They're susceptible to mistakes, just like you and I, right? And within this contract or this MOU, those are the things we're pointing out. Everybody's pointing that out. We're not against it. We want the health system in Liberia to improve just as much as you and I. So if a politician gets sick, they don't have to fly to Ghana or come to the States to get treated. If it gets improved, everybody benefit. But we're just saying, fix the problem. Then you go back to the drawing board. That's it. Over to you.
Thank you, Gabriel. So I don't know what number you're using to come up with the $6. Is that Liberia's overall population?
Yes. So and again, that is a kind of I can break it down to you. So I use assessment of a 5.6 million divided by I think 176, right? We can even break it down, it'll be less, right? Now, here's the point, argument. Not all the population in our country go to the hospital. So you can say, maybe we can break this down collectively and say, to those who regularly visit or those who are, they probably visited and they have some kind of disease and they think they're going to be going back. We can break it down to that. What I'm saying, either way you look at it, it's still small. Why? Here's the point. For those of you that like to argue, we have a strategic relationship with the US. We do. If you're going to treat your step sister or step brother like that, you give them penny on the dollar. Why are you giving everybody else, strangers, 2 billion and such? That is not a fair deal. But I'll turn it over to you.
Yeah, I've also seen that concern on social media. People are looking at the figure in Kenya, which is I think 2.3. Uganda
2.5
also
billion,
is,
right?
yeah, Uganda is also around 1 billion. And they're saying, why is Liberia getting 126 million? So, I mean, these are questions you can't answer for the US government, because also what we need to factor into all of what is happening is um, strategic geopolitical considerations. If you look at Kenya, for instance, is one of the partners of the US in East Africa. And until quite recently, Kenya was the biggest economy here in East Africa. So Kenya has a lot of influence. If you look at Uganda, Uganda is extremely big. It has a role in fighting Al-Shabaab in Somalia. They also balance against all of the refugees that are coming from South Sudan and even those that are coming from Sudan now. So these countries have some geopolitical importance to the US. Also, their populations are large. Even the beneficiaries we are talking about, people who suffer from HIV and AIDS, East Africa, in many instances, have a larger population of these people as compared to us. Our report that just came out, like Anthony said, I think 36,000 persons, right?
36,000.
36,000 persons that got HIV and AIDS. If you go to Uganda, that's going to be in the millions. So maybe there are these considerations that are making the amount to be huge. I agree to you. If, as a Liberian, I would want us also to be 1 billion, so that you give us 1 billion under this new arrangement, where you don't have all of these NGOs that are flying between Washington, D.C. and Monrovia. Maybe it could benefit us. But I can't really answer that question as to why our money is small. Maybe we'll take the small one, we do what we can do, and then it can improve. On Anthony's concern, I think he's been raising one point throughout the show. And the nuance I would like to put there is that on the issue of a law for protecting PII, if this the data that we are talking about here, in the negotiation of the Ministry of Health and the Ministry of Foreign Affairs and PIH, Public Health Institute of Liberia, if the data that will be reported is only limited to project performance level data, then of course we can go ahead in the absence of a law for protecting personal data, because personal data is not going to be reported. And I continue to disagree to the points that you guys are making, that for the fact that a donor supports a system and even provide technical assistance for building that system, then it has unfettered access, then it has the password, it has all of the information in that database. It's something I'm saying no to. Because this is a sector I've been in almost throughout my entire career. Even funding agencies, you build these systems, and then when you need data from it, you go back to that very country and go ask for the data, even the UN system. Because let's say you left, you built a system in 2024, December, you left. Now you want to report current data, but your consultants had left 1 year ago. It means that data that they met in that system, you think that what they will report? No, they will not report it. So you can say we are poor by whatever means, but we are still a sovereign country. There are things that we have control over.
So let the laws reflect that. The laws are not reflecting that.
Exactly.
What I'm saying is that at this point in time, we don't have a law on that issue. And if we are not reporting that data, then it doesn't matter in this case.
You and I, now we can agree that you and I are both speculating, right? I'm speculating that things should be put in place before it happens. You are speculating that, oh, it will not happen because we are going to allow these people to.
No. I'm not speculating. What I'm saying to you is that if PII data will not be shared as part of reporting against the indicators in the MOU, one second.
If someone have access to a software or data warehouse that you use, it is your responsibility to make sure that that data is differential. Meaning that if they were to come back in and have access to it, they should see it and not know what is actually going on.
And that's normally the practice. This is what I'm saying to you. So I'm coming. Gabriel. Even when we deal with, for instance, you deal with financial sector data, right? I deal with tax-related data. When there is a study, for instance, by an international financial institution on taxation, what do we do with the data? We anonymize the data. So that means all of your information related to your name is
stripped
removed.
But
away.
that is what you
One
said.
second, Mame, let me finish. Yeah. All of the data related to your personal tax identification number, your TIN, it is removed from the data. So even if the tax authority takes all that data and send it to the institution that is doing that research, the only thing that go is the figures that you pay. This year you pay $200. Next year you pay $300. They can use that to do their identification or their analysis, but they cannot tie it back to the individual taxpayer. This is the point I keep making. If the Ministry of Health and all of the government institutions collect data at the individual level, that is when you go to do HIV tests, you go for malaria tests, they will take your information. But time for reporting, they anonymize the data, then of course it's not PII. This is the point I keep making.
Is there a difference between access and reporting?
There is a big difference.
Yes.
Because what I'm trying to make you to understand is that if I come to your house, right, and I have possession of your actual computer, right, I have access to it. Now, I can go and install whatever. I can help you out and say, oh, I want to fix a computer. I want to optimize it. I can install a malware on that system that can make it possible that your computer can talk to my computer at home
Without you even knowing.
Hold on now. But there should be laws in place that will prohibit me. If it doesn't prohibit me, and I break that law, now I can go to jail or be prosecuted according to that law.
Right.
Liberia, it does not exist. So if the U.S. government comes to Liberia, when they come and they optimize the system, the data warehouse, and putting it in the cloud, storing it and overall, in the hardware and everything else, right? They have access to it. Now, there should be a law in Liberia that prohibits them, is what I'm saying. Not when the data is being collected and they're reporting. Reporting is different. Access is where they have access to. You cannot tell me that the U.S. government will come and build a system while we're still at it. Currently, in that DHIS2, there are currently data already there. They will have access to that as well too. Correct?
You finished?
The data is already there. They will have access to that as well too. There is not a law that prohibits them from what they can do with that data, is what I'm saying.
So, Thomas, come in, and then I think we should be wrapping up here. Thomas, go ahead.
So, like I said from the beginning,
and then
the access that you're discussing is going to be on a basis of when it is needed. So it is not just the case that because they've agreed to give this grant and then the MOU is signed, you take all of the data and the information and the system that Liberia has and you turn it over to the US government. That's not how it works.
He won't get it.
You're missing my words.
He won't get it.
No. So, Anthony, I work with these people for many years. Whether it's the Ministry of Health, the Ministry of Education, the LRA, the Ministry of Finance. Why you think it is difficult for them to have addressed? If the donors were so powerful, they could take charge and tell Liberia to do anything. Why couldn't they control the salary of people like Mr. or Joseph or Mr. Tao said? It's because these people are a sovereign country. They can do whatever they want to do.
They don't have interest in it. They don't serve their purpose.
Not at this point. They don't have
coverage,
exactly.
And so you're beholden to them. They actually encourage corruption.
Mr. Thomas, can you and I both establish that there should be a law, a data protection law, that will prohibit the U.S. government when they have access to the system, that will prohibit them from not, doing anything with the data that they see. I work in the healthcare sector as well, and I have access to people's PHR.
Okay, so this is my question. This is my question to you. What kind of data do data protection laws protect? What kind of data?
PHR.
That's my point.
Does Liberia have a PHR?
So listen to me. If we are going to have a PHI law, it protects what? PHR, right? My point I keep making to you is that the reporting that takes place against those indicators.
It is not
they
the
are,
reporting
listen,
I'm talking about. You are talking about the
Oh,
report.
man.
That is when the report is already built. I'm talking about the access.
He's
Will
not
the-
getting that, and
will the
I think I've
United-
exhausted
my
myself
question,
explaining that.
my
It's,
question is that will the United States government have access to the system that is being built in Liberia, the data warehouse? Will they have access to
you
that?
don't need
I
reporting to have
answer
access.
this question and you keep bringing the question. In the MOU, listen to me. Just give 1 second. If you go to the MOU, like I said to you, there's going to be an audit. So this is reimbursement. So the Liberian government is going to go ahead and spend the money, and then the US government will reimburse them. Before they can release those funds, they will have to verify that you achieve those outcome indicators that are in there. So time for that audit, they will come. And the data that you have in your system, there are instances where they will selectively look at it. If you report and say, this is the number, and they will say, let's see. Let's check the database and see. They will be able to go through and see. That's verification. They will go through it. Repeatedly, I have said to you that we don't have a law on PRR. But if the data that will be collected, the PRR portion will be protected by the government, then we don't need a PRR law to go into this
Thomas,
this
don't understand
MOU.
what he said. The
Mr.
question
Thomas,
he asking, let me
He's
come
not-
from the
he's not
question he
getting
asking
it.
is
can
this.
I ask you another question again, Mr. Thomas?
Anthony,
Hold on 1 second, Mr. Joseph. There are currently, right? Not only just the U.S. government that I'm worried about. There are other health professionals as well too. Currently, there is not a PHI that prohibits those professions, those healthcare professionals, from taking people's actual PHI or PII and putting it out in the public.
Definitely.
So why is it that we should not have that built on, that when the U.S. have access to these systems to optimize these systems, that they can tell them like, hey, even though you have access to these systems and you're going to be seeing and viewing some PHI, correct? While you optimize this system, because if you look at the data, right, without the gathering and of the data and reporting it, in order for you to go into the system and optimize it, you will need to see how the system works. And by seeing how the system works, you will need to see how data is being translated, how it's being entered, what sets of data are being entered, what is the name, the date of birth, the person's sicknesses, the PHI, right? The US will have access to that.
when they're optimizing,
What you are not getting is PRR also. You get to see PRR based on the basis that you need to see it. It is not that PRR should be hidden from everybody.
Under what laws?
No, I'm coming now. You keep asking the question, I'm answering the question. We don't have a law on PRR now, right? You are saying that we should have a law on PRR before we can enter the MOU. Yes, I agree to your point. The clarification I'm providing to you is that if the data that will be reported under this MOU will not be PRR, then we don't need a PRR law to go into the MOU.
you need it.
We don't need it to go into the MOU because we are reporting outcome level data.
So for the collection of the data, the collection of the data, you don't think people need PRI to collect the data?
The data is collected by the government. They will collect the PRI, but that is not what they are sharing.
Okay, the government needs PRI as well too.
That's what I'm saying to you. We need it, but we don't need it as a precondition for this MOU. You can't get this.
How can you collect data
if the data that we are reporting? If the data that we are reporting is not PRI data that we are reporting, why do we need it?
Can I make a point?
Why do we need it?
Any hospital in Liberia that has collected PHI on anyone in Liberia, they have actually violated someone else's rights.
Definitely.
There is no law right now that says that PHI is protected. So why is it that the government will not, that 1986 Constitution does not even have anything on that?
What you are mixing up is that this MOU is set forth on specific indicators that we need to report on. That's the data that's performance data. Anytime you implement a project, even in the education sector, If you train teachers, you report on the number of teachers that you have trained. You don't have to submit their names. You don't have to submit the certificates they have. You don't have to submit their addresses.
Yeah,
So
Thomas.
let me just finish. If we are not reporting PIR, why do we need a PIR law as a precondition?
And this
so
is
all
why.
All the projects you've implemented
Because we are collecting PIR in order for you to
I agree with you, but
the
the PIR we are collecting is not what we are meant to report in this case. If we are not reporting PIR, why should it be a precondition?
I rest my.
I'm not saying the government does not need a PIR law.
He doesn't get it.
You guys are not understanding me.
No,
I'm not saying the government does not need a PIR law. We need it as a country. This is why I say every data that is protected under PIR law is personal data. My name, my address, my medical records, they are personal to me. My savings record and everything, they are personal to me. These are the data that will be protected under the PIR law. But if the reporting under this MOU is meant to report against indicators that are at the outcome level, at the output level, and PIR data will not be reported, then we don't need it as a precondition.
Thomas,
how many times should I say this?
Thomas, we need it.
This
thing is very simple, right? This thing is very simple. You are talking about reporting. That's something completely different. Remember, the U.S. is bringing in the tech contractors to have access to the existing infrastructure to then improve it. At that point where they're improving it, those contractors that are loyal to the U.S. government will have access to those information. And when they built the entire system, the point here is that they are able to put malware in there that will automatically relay all of the PIR and PHR that you're talking about to the U.S. government. And so if that was to, listen now, this is not when you are reporting this one, you don't even have to report it. As you are entering it, they are getting it. So the point that he's making is, if that scenario was to happen, that law should be in place, that the U.S. would know that if they did that, they're violating a law and there can be a lawsuit. Okay. That is the point. It is based on that. So it's not what we are going to report to them, it's what they're able to actually steal through the back door by planting something in there when they create that database.
Okay.
That is the
so
point
why you have explained is your insinuation that they are going to plant something.
They're known for that. They're known for that.
Come now. Let me come. If anything is planted in your system, there are two things that could happen. The only way they can have access to that data is when you are unable to detect that something has been planted. But if you have one second, I will listen to your talk. You will not listen to me to talk. The first thing you say is that when they come to enhance your system, they see all the data that are in there. It is possible you can anonymize all of the data that is in that system. When somebody comes, they will not see any PIR. That's possible. This is why I keep saying for us to sit out here. 1 second.
They have to have access to that for them to be able to enhance and build that stuff. Yes, they do.
The system is different from the data that is in the system. You know that? The system is different. The infrastructure is different. You can anonymize the data in that system. Somebody can come to upgrade that system. They will not see it. I also said from the beginning that we should not think that all of the work that will be done under technical assistance will be done by foreigners and will be done by US people. It is when the capacity is not in country. If the capacity is in country, the Ministry of Health, as an implementing partner, will contract people in that place to do it. You know the different IT systems that are being built across the government with local firms? There's an option that they can do it. I'm not denying the fact that those things will happen. Somebody will come and plant a malware on your system. This is why we have IT people also to be able to identify that. But those people who come to do the work, they do it for a period of time and they leave. So until if a malware is planted, you should be able to identify. Once you lock the system up to that malware, they will no longer be able to access your system.
Yeah, but what happens if
scenarios
already access some of that data? Where is the law that showed that they violated something?
That's why I said to you, you anonymize the data even before somebody can have access to it. So how would they get PII?
Oh, wow. Thomas,
How would they
I
get the
work,
PII?
Thomas, I work with
Anyways.
database, and somebody come into my database. I hire tech people all the time, and they have to
Because
see.
the way you're
Listen
presenting
now,
the
listen
case
now,
is like
listen now.
every IT firm. The way you're presenting the case is like it goes out to the public. It's like anytime you hire an IT firm, they do criminal things. That's why you are saying.
No, but the U.S. government is known for that. They are on record, not just them, all government. They accuse each other. They're known for planting stuff and for doing, so we know this. So you want us to just forget the history of people that have the habit and somebody that is stronger than you that you can do, and they're funding it, they're bringing their own people and everything that is loyal to them, and you don't want for us to even question this, for us to even say what we should put in place. Why do you want us to remain naked, that we can at least even agree that, you know what, this could be an issue, let's put this XYZ in place. But you want to just say no.
Let's
I
wrap
don't
it
get
up.
it.
Let's wrap it up. I think I've
Oh wow.
I've settled my case with that. I believe I've stated my point. We categorically are not, against this MOU.
Somebody
We
says
just think
solution.
there are a lot of loopholes that are
Yeah,
susceptible
because
to
I
exploitation.
think they say motor solution because everything you'll be talking about fear mongering.
Right.
Yeah, we are talking
Yeah,
solution.
That's my point I'm making. That's my point I'm making.
talk solution now.
I believe we're not against this whole MOU, but we believe there are a lot of loopholes.
But Gabriel, it's still an
exploitation.
MOU, right? It's not a treaty here. So how can we make
Exactly.
this better
That
for
is
it to be in the agreement? What else can we put in this agreement?
right. And those are the point that we're talking about. And Anthony keep raising the point that we need some data protection laws, right? And that Thomas, and I think there's two things I want you to take away here. Reporting and access to data are two different things. You focus on the
No,
reporting,
that's what I want
Okay,
accept from you.
right?
These
talk
are
to all of us,
elementary.
not
These are
someone alone.
elementary.
Right.
These are
So
elementary things I know. You
let
don't
me
want to
let me
enforce your
let me
point
make the
on
point.
me. No,
Let me
I
make
come in now. Don't
No,
enforce your
come
point
on, but
on
let
me
him
as
finish.
let me
no. I
finish.
come in now. I come in. He been saying this thing from the chat room.
Let
Don't
me
make your point as if I don't understand the difference between reporting and
because
access. These are two different things.
so
What I keep saying to you is that in the MOU, we are to report on outcome level indicators. We are
so
to report on outcome level indicators.
let
So
me
the
make my
data
point here,
that
then
comes,
we
the
can wrap
data
it
that
up.
goes to the
But
US
Tom, do you
government.
believe this MOU can be, what can be improved in that MOU when it
He
becomes a
doesn't think
treaty?
anything can be improved in there, and I
No.
think everybody
I will
keeps
tell you
saying that.
what can be improved, but
Let me
don't tell
state my
me
point here,
access
then
and
I'll rest
yeah,
my
go
case,
ahead.
right?
Go ahead.
So I believe we every one of us on this platform do want the country to improve, especially the healthcare. JFK has been nicknamed as just for killing, right? People die there regularly. Your politician leaves the country when they want to get healthcare. They go to Ghana or they come to the US, right? So we do want the system to improve. However, this MOU as it was presented has a lot of loopholes that need to be rectified, that the Ministry of Health need to take this back and go back on the table and look at the data protection law and look at the data access, how information will be shared, right? And then come back to the table. That's what we're saying here. We're not saying, oh, we're against this. And you have to look at the entirety of this MOU, right? So that is the point we're making here. And I think the misconception here or the confusion is the reporting aspect versus the access. If you have access to a data warehouse or system, I don't need you to report to me anymore. I can go in there and tap into that and access it, right? So you need to state categorically within the MOU the intellectual property, who it belongs to, the time frame of the scope of work, when it's being turned over, all of those things. And again, I will take this back, right? It's an MOU. It's not a full contract yet. So maybe when this is fully signed, they will implement some of these things we're talking about. So I don't want to dwell too much on this. But that is my point of contention. The data access, the reporting, the intellectual property, who owns it. And again, my last piece is I think we're getting too little for the MOU. I yield. Thank you.
Thank you, Gabriel. So the reason why I thought to engage on this issue is not only to report to respond to us panelists, because we have sufficient and enough of it in our chat room, but this is something that has been spreading across social media since this agreement was signed. That Liberia is taking, it started with Kenya, like I said to you. Once Kenya signed the agreement, there were some social media videos that came up. I listened to one lady, and she was just presenting it as if they were going to test everybody and take their blood sample and take everything and ship it to the US. And then some people from Liberia also started to raise this issue. For me, what I wanted to clarify is that every time you take money from someone under an aid arrangement, there has to be a reporting mechanism. And maybe I didn't mention this from the beginning of the show. The US government, for instance, has a specific law. They call it the Government Performance and Resource Act of 1993. In 2023, in 2010, they had a modernized version of it. And it requires the US government, wherever they spend their money, they have to report back to Congress as to what has been achieved with that money. So the reporting that comes under this MOU is basically to be able to go back to Congress to say you gave us 126 million to go to Liberia to address the issue of malaria, to reduce maternal mortality, child mortality. In 5 years, this is what we have been able to achieve. So to me, who has worked in development for these many years, this was not something surprising to me, because whether it was DFID, it was GIZ, it was Sweden, you had to report. So to just say that we're going to take data, performance data, and report it to the US government and there's an alarm, why should it alarm us? It's like a project. You implement a World Bank project, you have to do this. This is why even when USAID was existing, every project had an MAE person, monitoring and evaluation, specifically to collect data, to report back. On the issue of the PRR, I have said repeatedly, we don't have a law on PRR. And this is a limitation that we have as a country. We do things when the legal framework, sometimes the policy framework is not in place. I even mentioned the issue of rules that we are building under a public-private partnership when the public-private partnership policy has not been finalized. But my area of nuance and disagreement is that if we are reporting project performance data, and that will not include PRR, then we don't need a PRR under this agreement. We need PRR for all of the other limitations that Anthony was sharing. You see people go to hospital in Liberia, by the time they leave from the hospital, their information is on Facebook. That's a violation of privacy. We need PRR to solve the PRR problems in Liberia, not only within the context of this MOU, but in the context of the broader protection of private data that we need, but not under performance level data or implementation. On the MOU, what can be improved? Like I said from the beginning, I know the Ministry of Health and Field were all involved with this process. The Ministry of Foreign Affairs was the one that signed, they were involved with this process. So in their negotiation of the MOU, if they knew that PRR was not included, and it was not part of the reporting that was going to be done, they decided to move forward with it. If PRR would be included, I agree with you guys, then we need a law. Then what we have to do as a country is to say, okay, let's pause the MOU until we go past the law. The lawmakers have gone on break. They will come next year. They'll pull it, they send it to committee room. Maybe that 2027 or 2028, it will come. So there could be places where these things could be improved. In the building of the systems that are there, like I said to you, there will be contracts. You don't just come from the US and go build a system in Liberia. There will be contracts that will be signed between the government of Liberia and those that will provide the technical assistance. In those contracts, some of these guardrails can be set. We don't just open the system to you and we say, because we open it, then you will just take information from there. That's unethical. You don't do it. So even in the absence of the law, those contracts can provide guardrails for you to be able to address these things. So along the implementation path, those things can be done. Maybe they can go and clarify further in the MOU to say the data we are talking about here is not PRR, is what? Project implementation data. Because I think this is where the confusion is coming from.
Thank you. So Brooks.
Look at what happened here.
No.
There was no confusion here. For me, I am clear on what I'm saying. there's record of the U.S. government been known for this, for plucking and spying on people and pulling information. And you're saying that we should forget about this. So we are saying, let us put laws in place that in case, for the proponent of the people that agree that this should go on in the first place, from what Anthony and Gabriel are saying, and everybody else, I follow your whole discussion on the platform, that there should be this law already, so that when they have access to this infrastructure, when the integrator do whatever they have to do with it, so that if they were to put a malware in there, and if it were to be found out later that this breach happened, that they can be held liable based on this agreement that it was right here and you sign it. But it shouldn't be in reverse, that after it had happened, then we catch it and we're trying to, no, we don't want that. That is what they're saying. But look, for me, we don't need this. We do not need this. The reason I'm saying this, and I want the Liberian people to listen and listen very well. USAID, which is an arm of the state, or was an arm of the State Department, don't let nobody tell you that there was a difference between them. No, there was not. There was no difference between them. It's on record that through USAID, they implemented policies and projects on behalf of the U.S. government. And so they're one and the same. The fight that they had in dissolving it was internal corruption of one group trying to take over the loot. Now you see that the Trump administration is bringing their own people in the stuff as the IT people. The contractors, they're coming in and they're going to put this in place. And they're not loyal to you. They're loyal to the government that is paying them, that they put. So whatever they want, they can channel it back to them. But what they did with USAID and Swedish Group and all this stuff with the same health sector, how in the heck they tell you that they put over $1 billion into your health sector? And there is no quantifier something that we can point out. And all I can be told is that RNHH and all of this stuff. No, where is the real? And if they put all that in place, let's see what is the actual impact that health system is having on the public.
Yeah.
As they said, they were putting all the money in, the health system was getting worse.
Have you looked
this
at
is the difference? So this is the difference. They say they put over almost $1 billion into your agriculture. But there is not one thing that you can. I have my cousin that worked with that whole agriculture stuff. I was in Liberia, and I asked him what he really do. Nothing. Okay? So what happened?
Right,
but we can say all this money, we can read all the fund lines and all the fund policies. But let's look at the actual outcome.
Right.
Nothing, it doesn't exist. No, it doesn't exist.
Yeah,
we can read all the stuff that they achieve a bunch of stuff. Let's look at the energy sector that they were part of. Why they were part of that energy sector? Are we saying that there is enough energy now in Liberia? Just the hydro alone is $1 billion. It said it don't even work. Look at in Guinea, when the Chinese engaged them for 250 million, they have a hydro that is supplying everywhere. No, let be realistic so we can read all the fund number data, all this stuff. Now let's look at the actual outcome of this thing. So what this is going to do is just like the same thing. They already told you in there that they can pull out anytime. So what this will do for me is anytime they feel that they don't need this system anymore, they pull out, we are still back to square one. The system will collapse just like it collapsed when they were running health, education, agriculture. For this reason, we don't need it. We need to pressure our government. Allocate money in the budget.
The Omega Tower. Yeah.
Yeah, allocate money in the budget so that we handle our own healthcare system. 125 million is not much.
Thank you. I think we need to wrap up. Just a quick announcement. Next week, we will be having a discussion on the Sovereign Wealth Fund. So we're going to have a part series. I know it's been out there, but we want to, give a
Sovereign Wealth Fund from where?
Sovereign Wealth Fund, establishing a Sovereign Wealth Fund in Liberia. There was supposedly a bill on the floor. I'm not sure if it's on the floor yet. Somebody raised it, and there's a discussion about it. So we're going to have a conversation about that to really talk about what sovereign wealth funds are and how that can be implemented. Yeah. Comments you were saying before we close?
Yeah, just 30 seconds. This is why, for me, I can say I don't like people to just make sweeping statements. Aid overall is not effective, except if the government itself really directs aids like other countries have done. But don't just generally dismiss the support that has been given to Liberia. If you go to the health sector, for instance, in the year 2000, maternal mortality ratio, that is the number of women that were dying from childbirth in the year 2000, was around 770 per 1,000 live birth. No, 100,000 live birth. Out of every 100,000 women that gave birth, around 770 were dying. In 2020, that number came down to around 409. You have saved the life of many, many mothers because of these different investments that have gone through maternal mortality and all of
And how
that. You
did
can
this
take
say
child.
how
One second. When you're
So
talking, I
I
don't
think
talk.
the point that he's
You,
making is
you,
the amount of money that was put in the system compared to the the, the, the impact that it's
but
had.
even the amount
Not
of
that
money, he
the
doesn't
right.
know. He's just calling figures. You can
no,
take child
they call
mortality.
these figures.
You
I
can
got
take
this from
child mortality.
USAID website themselves.
One second now. You can take child mortality. USAID was not the only funder of the health sector. DFID was funding. GRZ was funding. So in international developments, these high-level indicators, each partner can only contribute to it. You can't attribute everything to USAID, right?
They said that on their
So
own
what I'm
website.
saying to you is that all of the investment that has gone, we have made progress in reducing maternal child mortality, under 5 mortality, and all of that. Even the incidence of malaria, those things are coming down. We've now gotten to a place where we are perfect. But to just sit down on the show and just dismiss it, it didn't do anything. They just put the money there as if people were just uh, taking these resources and
After
eating
spending
them. It's
almost 2
not
billion
true, man.
to
Dennis, could
reduce
you please take us home?
mortality
Gentlemen,
and
I
malaria.
think the
So
time
let's
is
let's
well spent.
let's close the show. Next
Yeah.
time we'll come in. Your when Mr. Tao here, read some little more details.
No, there is no detail to read. Thomas, let me tell you something. Don't
Dennis,
try to
are you
act
still
like
there?
somehow I don't have common
Yeah,
sense.
but the
You
argument
come from the grant background and you stand to profit from these things because then you get contract. Let's be realistic here. So this is harming us.
Yeah.
Okay, it doesn't
I
work.
agree with you, Mr. Towell.
It
No, that's
doesn't
why I
work.
said we have a choice. We have a choice to say we don't want aid. That's a
Yeah,
choice
we
that we have.
don't.
But my
Exactly.
point to you is that if you take aid, then you have to report against it. Because these people who gave you the money also have to report to these are taxpayer resources. So that's my point.
Fair
I
enough.
agree with you. We don't need
Fair
aid.
enough. Right.
But
Fair
if we
enough.
take the aid, then we have to report. You cannot question the reporting. That's my
Fair enough.
point.
Fair enough. Yeah.
Yeah. Okay.
But gentlemen, thank you for a very lively discussion. I think we could have continued for probably another 2 hours or so because there's a lot to talk about. But thank you for taking the time, and hopefully you're able to join us on Saturday as we dive into sovereign wealth fund. This is a topic that came about when about the 200 million, a signing bonus from I think is Asalamitau. That we could have we could have taken that money and put it somewhere else, and what could become of it if you scale it over time. So I believe Ty Wongwe, who's the representative, put out a bill already. But we want to look at the mechanics in terms of we want to look at other countries that have done it and why can't we do it? And if we were able to do that, what the outcome could be maybe over 10 years, 15, 20, 30 years.
That's where we should be putting our energy, not $126 million MOU. Why we can't do that? Yeah. The minister of lands and man say, let's establish a company or put all our mineral under the company, they sack him. These are things we're supposed to be talking about.
It goes back to what Mr. Tower was saying, that there are people
it goes back to us.
Develop. Right.
It's not the development partner, it's us.
We'll have another discussion on Saturday. Thank you guys. Dennis, sorry.
What time?
We all love you.